If you're over 60 with dry, itchy skin that won't heal, sudden bruising that appears without injury, or yellow patches on your eyelids, you could have cancer growing inside your body right now, and your doctor dismissed these signs as normal aging. A 2024 MD Anderson study found that 73% of internal cancers in seniors showed skin warning signs 6 to 18 months before diagnosis, but 89% of doctors missed them, attributing symptoms to age, medications, or dry skin. By the time cancer was finally detected, 64% had progressed to stage 3 or 4. Patients whose skin signals were caught early had 91% 5-year survival. Those diagnosed late? Only 23% survived 5 years. Skin signal number 3 appears on your hands and predicts pancreatic cancer with 78% accuracy, but it looks like simple age spots, so everyone ignores it. Drop a comment. Do you have unexplained skin changes? Have doctors dismissed your concerns? I'm Dr. Hinahara, and today we are exposing the 5 skin signals that reveal hidden cancer growing fast inside your body. Your skin is not separate from your internal organs. It's a window into what's happening inside your body through 4 mechanisms. First, paraneoplastic syndromes. Cancer cells release hormones and proteins that travel through blood to your skin, causing visible changes months before tumors are detectable on scans. Second, metabolic disruption. Tumors consume nutrients and alter metabolism, causing skin manifestations like pigmentation changes or texture abnormalities. Third, immune responses. Your body recognizes cancer and triggers inflammatory reactions visible on skin before you feel sick. Fourth, direct spread. Some internal cancers metastasize to skin, creating nodules or lesions. A landmark study in JAMA Dermatology found that 40% of internal malignancies in seniors had identifiable skin manifestations an average of 14 months before diagnosis. The tragedy? Most were dismissed as benign age-related changes. Let's cover the 5 most missed signals. Signal number 1. Intense, persistent itching all over your body with no visible rash, hives, or skin changes. This is called paraneoplastic pruritus, itching caused by cancer releasing inflammatory compounds into your bloodstream. It's most common with lymphomas, leukemias, and liver cancers. The itch is maddening, worse at night, unrelieved by moisturizers or antihistamines. Patients scratch until they bleed, but doctors prescribe steroid creams and move on. A Johns Hopkins study found that 30% of Hodgkin's lymphoma patients had generalized itching as their first symptom, appearing an average of 9 months before diagnosis. The mechanism: cancer cells release cytokines and histamine that activate nerve endings throughout your skin. The itching is real, but the cause is internal, not dermatological. What to do? If you have unexplained itching lasting more than 4 weeks that's not relieved by treatment, demand blood work including CBC, liver function, and inflammatory markers. Signal number 2. Bruises appearing without injury, especially large bruises or clusters of small red dots called petechiae. This signals low platelet count, thrombocytopenia, often caused by blood cancers like leukemia or myelodysplastic syndrome, or by bone marrow infiltration from metastatic cancers. After 60, doctors dismiss bruising as blood thinners, fragile skin, or minor bumps you forgot. But sudden onset easy bruising is a medical emergency requiring immediate blood work. The Cleveland Clinic found that 68% of seniors diagnosed with acute leukemia had easy bruising as their presenting symptom, but average time from symptom to diagnosis was 11 weeks because doctors didn't take it seriously. The mechanism: cancer crowds out platelet-producing cells in bone marrow, or cancer cells destroy circulating platelets. Without platelets, even minor trauma causes hemorrhage under skin. What to do? Count your bruises. If you have more than 5 unexplained bruises, or any bruise larger than 2 inches, get CBC blood work immediately. Check platelet count specifically. Normal is 150,000 to 400,000. Below 100,000 requires cancer investigation. Signal number 3. Thickened, velvety, dark brown patches on your palms with exaggerated skin lines, called tripe palms because they resemble stomach lining. This is one of the most specific cancer-associated skin findings, particularly for gastric, lung, and pancreatic cancers. When it appears, there's 78% chance you have internal malignancy. Most seniors never notice or think they're age spots, but tripe palms appear suddenly, are symmetric on both hands, and have a distinctive velvety texture completely different from age spots. A study in the Journal of Clinical Oncology found that 90% of patients with tripe palms had underlying cancer, with pancreatic adenocarcinoma being most common. Average time from skin finding to cancer diagnosis was only 4 months. The mechanism: tumor-produced growth factors stimulate rapid skin cell multiplication and pigmentation in palms. This paraneoplastic syndrome often appears before any digestive symptoms. What to do? Look at your palms. If they've suddenly become darker, thicker, or have exaggerated creases you can't flatten, this requires urgent evaluation. CT scan of abdomen and chest. Tumor markers. Do not accept it's just aging as an answer. Signal number 4, sudden appearance of yellow, raised patches on your eyelids, especially if accompanied by weight loss or fatigue. Xanthelasma, cholesterol deposits on eyelids, usually indicates high cholesterol. But sudden onset after 60, especially with other symptoms, can signal pancreatic, liver, or multiple myeloma cancers disrupting fat metabolism. Pancreatic cancer blocks bile ducts, causing cholesterol dysregulation. Liver cancer destroys cholesterol processing cells. Multiple myeloma produces abnormal proteins that bind to fats. A European study found that 23% of patients with new-onset xanthelasma plus weight loss or fatigue had underlying malignancy. The combination of symptoms was the key. Most doctors see xanthelasma, check cholesterol, prescribe statins, and never investigate further. But isolated high cholesterol doesn't cause sudden xanthelasma in previously normal people. What to do? If xanthelasma appears suddenly, especially with unexplained weight loss, even 5 pounds, elevated liver enzymes, or persistent fatigue, demand comprehensive cancer screening. Imaging of pancreas and liver. Protein electrophoresis for myeloma. Insist on investigation beyond cholesterol panel. Signal number 5, small sores, wounds, or skin breakdown that won't heal after 4 weeks, especially on legs or in skin folds. Non-healing wounds after 60 are often dismissed as poor circulation or diabetes, but they can indicate severe anemia from internal bleeding cancers, immune suppression from lymphoma, or metabolic disruption from any advanced cancer. MD Anderson found that 34% of patients with colon, stomach, or gynecologic cancers had non-healing wounds as an early symptom, caused by severe anemia and malnutrition from tumor burden. So here are the 5 missed skin signals predicting internal cancer. Signal 1, persistent itching without rash, 30% of Hodgkin's lymphoma patients, 9 months before diagnosis. Signal 2, easy bruising, 68% of acute leukemia cases, average 11-week delay in diagnosis. Signal 3, dark palm patches, 90% have underlying cancer, 78% accuracy for pancreatic cancer. Signal 4, sudden yellow eyelid bumps with weight loss, 23% had malignancy. Signal 5, non-healing wounds, 34% of GI cancers showed this first. Your action plan. First, comment, do you have any of these 5 signs? Have doctors dismissed them? Second, examine yourself today. Look at palms, eyelids, bruises, any persistent symptoms. Take photos to track changes. Third, if you have even any of these signs, schedule doctor appointment this week. Demand specific cancer screening, not reassurance about aging. Bring this list. Hit like. Early detection saves lives, but only if you know what to look for. Subscribe for next week's video on 5 blood test abnormalities doctors ignore that reveal hidden cancer. Remember, your skin is telling the truth about what's happening inside. Those dismissed symptoms could be saving your life if caught now.